So as she told her story, I just was like, wow, this is such a remarkable physician. And I can't believe she wants to work with us. And then it was amazing to see Monica's evolution.
When I was young, we would go to India in the summers a lot. I loved being there, and it was a different world. Poverty was so visible. I noticed an older gentleman, and our eyes locked. I remember he gave me a gentle smile. And the next day, when we walked in that same area, I noticed that there was a blanket that was covering his body. And I was so struck by so many questions. Life seemed to go along around him. Where was his family? What kind of care did he get? Was there something that could have been done to prevent his death? And that really started my lifelong journey, wanting to focus on justice and fairness in health and doing my part to contribute to caring for individuals who are in these vulnerable situations.
She has really committed herself to lifting up the voices that often go unheard in our community and in our state. And for that, I am so immensely appreciative of her and her tenure and her legacy.
Monica is just relentless in her pursuit of the highest quality care. Access to healthcare is not enough. We need to be providing the most top-notch quality care anywhere. She insisted that we figure out how prevalent cancers are and how it really helped to show the disparity in cancer deaths among our patients, to the point where she's just leading focus groups. What are all the barriers? I know there are a million barriers, she would say, but if we don't get past those barriers, then what are we doing? She thinks of this as a social justice issue, and she brought everyone else around to that.
When I think of Monica Bharel, she sort of stands out as the perfect example of what we always dreamed of this program doing. So she came to us when she was still a student. I'll never forget, we had coffee one day and she was all interested in about, I'd love to do what you guys do. What do I need to do? And I was like dreaming of someone asking us that back in the old days when no one was interested in doing this job. And the thought that she would be interested in the work we were doing was fantastic.
You know, I was so proud of her and proud for us as a program when she became the public health commissioner.
I'll tell you that I had such an immense sense of comfort during the pandemic in 2020, knowing that Monica was at the helm as commissioner of the Department of Public Health. Even from that pulpit, from that level, she had our population front and center.
There's so many other things to say. I think she's left such a big legacy. Her tenure as chief medical officer just shaped so much about the way the program looks today.
She is an incredibly skilled and good doctor whose patients absolutely adored her.
I'm just so incredibly grateful to Monica for her friendship, her mentorship.
Monica is a mentor to so many women.
Monica, I was fortunate to have you as a colleague and even more fortunate to have you as a friend.
I think back now and I want to say to Monica, what a wonderful accident that we ran into so many years ago. And then what great joy you've brought to us, and to me particularly, for showing us, what you can do in this world and how you can bring it not only to the patients you cared for, but now bring it to people all over the country and all over the world. So I am beyond grateful.
Hi everyone, I want to thank Boston Healthcare for the Homeless program for hosting tonight's Medicine That Matters Gala. I am so grateful for everything you do to lift up and empower our unhoused neighbors. That's the work that Dr. Monica Bharel has done throughout her career. I am so grateful for her support as our administration laid the foundation for our response to the crises of substance use disorder, mental health, and homelessness. She equipped our teams with the tools necessary to make Boston a national model for what it looks like to center public health and public safety in our approach to these issues. Dr. Bharel, I am so proud to call you a colleague and a friend. Thank you, and congratulations on this well-deserved recognition. Finally, I'd like to thank all of you here tonight for your generous support. Without you, none of this work would be possible. But because of you, thanks to you, BHCHP is able to provide life-saving care and empower residents across the Boston community. So thank you.